If you get on a plane, nearly any commercial flight, air vents allow you to breathe normally. The air pumped into the cabin includes bleed air. That's been sucked in by the engines, then compressed, and finally circulated with the existing air inside the aircraft. But sometimes that bleed air is contaminated with remnants of engine fuel or liquids. That's caused incidents on major airlines, including one in May when cabin crew became ill from the fumes. Well, a study published in the WHO's Public Health Journal says low-level leakage into the aircraft could be a problem, particularly for pilots and crew who fly regularly. A co-author of the report, a former pilot herself with a master's degree in airline safety, said more than 1 in 10 of the pilots she studied who flew the BAE 146 aircraft suffered chronic illnesses such as cancer, neurological problems, and some were fatal.
This problem is related to any aircraft using bleed air supplied off the engine, but that aircraft had a lot more problems, and the effects that they were getting were identical or consistent with what we would expect and what we've seen over and over again with exposure to these particular substances. This has been going on 5 decades, 6 decades in fact, and the symptoms they were complaining about then are the same ones now.
Well, EasyJet has just announced trials of a new air filtration system, but denies a connection to so-called aerotoxic syndrome. The airline says it wants to identify and reduce incidents of unusual smells and fumes in the cabin. These events can have short-term effects on health and lead to flight disruption. But it continues, this has no link with the study whether any form of long-term illness occurs in airline crew due to exposures to cabin air. Well, earlier this year, the European Aviation Safety Agency also said in-flight measurements have been conducted on a number of commercial flights after defining adequate and reliable air contaminants, measurements methods for cockpit and passenger cabin areas. The results show that cabin cockpit air quality is similar or better than what's observed in normal indoor environments. No occupational exposure limits and guidelines were exceeded. Well, despite the reassurances, other people in the airline industry, particularly those who've become ill, want more thorough research. Based on 2015 numbers, 500,000 airline crew could be exposed to the fume danger, and so could 3.5 billion passengers who fly every year.